behalf of the province today, in the following order, are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-paroles aujourd'hui sont...
Spokespeople today are the following: Chief Medical Officer of Health, Dr. Jennifer Russell, and the Premier of New Brunswick, Blaine Higgs.
Thank you, Bruce. Merci.
Thank you. Good afternoon,
everyone. New Brunswick is facing a grave threat from COVID-19. We have now 12 patients in hospital with this virus, which is more than we have seen since last April. We have 7 patients in ICU. Unfortunately, we have also recorded another death of a New Brunswicker from the effects of COVID-19, and my thoughts are with the family today. This is the 48th death that we've reported since the pandemic began in 2020. And I'm sure that every New Brunswicker will join me in expressing sincere condolences to the family and friends of this individual. Your loss is deeply felt by all of us. La COVID-19 menace...
COVID-19 is seriously menacing New Brunswick. At the present time, the number of people hospitalized after having contracted COVID-19 is higher than it was in last April. The number of people in intensive care after having contracted the virus at the present time is higher than at any other moment since the beginning of the pandemic. Sadly enough, we have to announce today the passing of another person in New Brunswick because of COVID-19. That is the 48th death in the province. I'm convinced that all citizens of New Brunswick join me today to offer the sincere condolences to the family and to the friends of the deceased person. We also share your sadness.
3 new confirmed cases of COVID-19. This is the largest single-day report we have seen to date. New Brunswick has 293 active cases, which is nearly as many as we saw in mid-January. We are now on a trajectory for 100 new cases a day, every day. COVID-19 is spreading broadly across our province, and it is spread among the unvaccinated. We can reverse this trend if everyone who can be vaccinated rolls up their sleeve immediately, if not sooner. More than 77% of eligible New Brunswickers have taken this step, and I applaud everyone who has acted. That is really the majority of the population here has done what we've asked, and it's really incredible when you look at the pandemic and how each and every time we asked New Brunswickers to step up, they always did. We need more now. We need more. Absolutely. So if you're in a position of leadership of any kind and you can help your members of whatever organization or community get vaccinated, it is imperative that we all lend a hand at this moment in time. We have
to protect our healthcare system. We have to protect our citizens that are vulnerable. We have to protect our children, those who cannot be vaccinated, mainly. We have shown a lot of patience. We have tried to accentuate encouragement. We tried not to be judgmental, but our patience has its limits, but as well, the capabilities of our intensive care has limits as well. In simple terms, if you're still not vaccinated, you're putting more than your own health at risk. You're putting in peril the health of your family, your community, and your province.
We need to protect our healthcare system, and I've heard that phrase, when I use that term, it seems to fall on deaf ears. We need to protect our vulnerable citizens. Again, my understanding is that not everybody is hearing that message. And in fact, because of that, the CEO of one of the hospital systems here in the province spoke up this morning at our emergency operations in brief and said, you know, we really do have to make it more, personal in terms of how this can affect every single individual in this province. We need to protect our children. We have been patient and we have strived to be encouraging and we have tried not to judge. And our patience is running thin. I think certainly for people who are vaccinated, that's the case. But I think certainly for the people who operate our healthcare system and are looking at ICU beds every single day and looking at our capacity. The plain fact is that if you remain unvaccinated, you are risking more than your own health. And the CEO mentioned that, you know, it takes more resources to look after COVID patients. And so when there are patients that don't have COVID-related illnesses or trauma, et cetera, it's harder to look after them. You are jeopardizing the health of your family, your community, and your province. The Premier will speak shortly on new measures recommended by Public Health to increase the vaccination rate in our province. And again, we have 77% of our population vaccinated with 2 doses, and we need more. We need that to be increased so, again, that we can continue to protect all citizens. I want to explain why these measures are needed and needed now. And we've done our research. So when people talk about doing research, this is our research. This is the facts and the data that we have today in New Brunswick about our citizens and our hospitals. In New Brunswick, the COVID-19 virus is spreading primarily among the unvaccinated, and more than 85% of new cases reported over the last 2 months have been in those who have not received their full dose of a COVID-19 vaccine. The vast majority of those who experience severe illness are unvaccinated. And again, we've said those numbers throughout the pandemic when we received the data on the efficacy and how effective the vaccines are. Up to 95% will be protected from severe illness and outcomes with a vaccine, with their 2 doses. Those who are hospitalized are also in this category. With respect to the majority of those who experience severe illness in terms of being unvaccinated, that most of our hospitalized patients with COVID-19 are unvaccinated.
More than 85% of new cases pointed out over the past few years, or 2 months rather, have been people who have not received their full dose of COVID-19 vaccine. The vast majority of those who experience this severe illness are unvaccinated. If you're not vaccinated in New Brunswick, you have at least 23 times more chances of being hospitalized after having contracted COVID-19 than a person that is fully vaccinated. This is a large percentage. It's really important to hear this message.
In hospital with COVID-19, even though they make up barely 20% of the general population. If you are an unvaccinated New Brunswicker, you are at least 23 times more likely to be hospitalized for COVID-19 than a person who is fully vaccinated. These are staggering numbers. And again, those hospitalizations take resources and time away from the care for other non-COVID related illnesses, trauma, etc. It puts our healthcare system under a strain. We have many staff out right now for COVID-related reasons who either are directly or indirectly affected right now by the numbers that are increasing. The focus on caring for severely ill COVID-19 patients limits our ability to serve those with other conditions. You know, my dad had a heart attack 3 years ago. I'd really like to be confident that if he had another heart attack that there would be an ICU bed for him. You know, my daughter has asthma. If she had a flare-up, I'd really like to know that somebody would be able to look after her. And I'm sure you have family members and friends and loved ones that you care about that you want to make sure can receive care when they need it, including yourself. This is now happening in other parts of North America, including as close as Alberta. It is really unfortunate. Surgeries are canceled actually right next door in Nova Scotia and Truro at the moment. Patients are being turned away because so many beds are being filled with unvaccinated COVID-19 patients in many jurisdictions across North America. This is the reality. No one wants this to happen here. Given the volume of new cases, I will not read the full list here today. It will be in our press release and on the gnb.ca website dashboard. But I will say that we continue to see new cases in every health zone across the province. We remain deeply concerned by the spread of the virus in the Moncton area, in the upper St. John River Valley, in and around Camelton, as well as in Fredericton. We can still turn the tide of this 4th wave. We can remain in the green phase of our recovery plan, We can continue to live a normal life as possible under the circumstances. That's what we're striving to do. That's what our goal is. But to do this, we need more people to get vaccinated. That is absolutely the most important thing that can happen at this moment in time. There are those who cannot be vaccinated due to allergies or their age or medical conditions, but we know that this is only a small fraction of unvaccinated adults in our province. The larger group of people who are unvaccinated, a larger group is those who are currently ineligible for vaccine, which includes children under the age of 12. They urgently need our protection. When small children become ill with COVID-19, our contact tracing has shown that they most often were infected by an unvaccinated member of their household, a family member, or a parent. The remaining group are those who have chosen to remain unvaccinated for whatever reason. And again, there are many reasons, and I do understand that is the case. But again, anybody who is in a leadership position, who has any influence or can offer help to anyone who needs to be vaccinated right now, it is imperative that you reach out and try to make that happen as best you can, as soon as you can. So for the New Brunswickers that aren't vaccinated, again, maybe they aren't watching today, and maybe the people that got vaccinated aren't watching either because they feel like they've done their part. But whoever is listening to our messaging today, either live or later the recording, it is a very important message. And I really want the unvaccinated New Brunswickers that do have access to this message to hear what it is that we're asking. We want you to set aside your doubts. I have heard from people who believe misinformation, who are really not satisfied with the information that the credible sources of information have supplied to them. And I'm asking that you really put aside those doubts and concerns, whatever they are. I ask that you put your community first, your family, your friends, your loved ones, this entire province, our healthcare workers. I ask that you take action to protect those who cannot protect themselves. Everyone who can be vaccinated must be vaccinated, and we cannot wait any longer. Je vous demande.
I would ask you to grant the priority to your community. I'd ask you to take this measure to protect the people that cannot protect themselves. Every person that can receive the vaccination must be immunized. We cannot allow to wait any longer.
There is a way to get through this fourth wave, and the most important part of that approach has to be vaccination, and it has to be now. And again, we've encouraged, we've asked. I am actually pleading now with those people who really have to get this done sooner rather than later. It is really imperative that we protect all New Brunswick citizens at this time.
Good afternoon. Bonjour. Marcia and I were saddened to learn of another person has lost their life as a result of COVID-19. On behalf of all New Brunswickers, I want to offer my sincere condolences to this person's family and friends. Our thoughts and prayers are with them at this difficult time. Since this pandemic began, our government has been quick to adapt, always acting in the best interests of New Brunswickers. As Dr. Russell mentioned, the number of active cases of COVID-19 in New Brunswick continue to rise, with 63 new cases announced today, the most our province has seen in a single day since the pandemic began. Currently, the number of hospitalizations is 12, with 7 in ICU. While still manageable, those numbers are concerning and have increased significantly over the last few days. Our vaccination levels also continue to rise, but not quickly enough. And action is needed to protect our province. Since July 1st, there have been 797 confirmed cases of COVID-19 in New Brunswick. Of those, 697, or 87%, were people who were not fully vaccinated. To raise the rates of vaccination and to reduce the spread of COVID-19, Cabinet has decided, on the advice of Public Health, that we make the following changes under the Public Health Act and the Family Services Act, effective Tuesday, September 21st at 11:59 p.m. Beginning next Wednesday, proof of vaccination and government-issued ID will be required by those 12 and over to access the following events, services, and businesses: indoor festivals, performing arts, and sporting events; indoor and outdoor dining and drinking at restaurants, pubs, and bars; nightclubs, amusement centers, pool halls, bowling alleys, casinos, and movie theaters; gyms, indoor pools, and indoor recreation facilities; indoor group exercise facilities; les rassemblements organisés.
And marriages, which are organized, and funerals, and holidays and spaces, public spaces, conferences, and workshops; recreational sports in groups, courses and activities that are organized inside, and visits in long-term care establishments.
Vaccination can be provided through various means, including My Health NB, immunization record from a regional health authority or pharmacy, immunization record from public health, photo of an immunization record, and other proof of vaccination from other jurisdictions. In approximately a month, we expect to have a QR code people can show on their phone to make it easier for New Brunswickers to provide proof of vaccination. Individuals who are unable to receive a vaccine because of a medical exemption will be required to show proof of that exemption. I know businesses will have questions. Our business navigators will be available to answer these questions and can be reached at 1-833-799-7966 and by email at nav@navnb.ca.
We are going to provide material for businesses like signage, so that it is very clear that this is a government requirement. I understand that this is another thing that some businesses have to make, but it is necessary in order to limit the spread of COVID-19 without having to impose closures or to adopt similar measures.
To help make sure businesses and patrons understand and comply with the new rules, enforcement officers will be monitoring compliance, helping everyone understand the rules and, where necessary, enforce the new rules. With these changes, we are targeting the unvaccinated, ages 50 years and under. In fact, if you look at the statistics, age 50 and up, the average vaccination rate is around 90%, which is our target. 50 and under, it's in the order of 65%. The demographic in this demographic, we are seeing significant outbreaks in the 50 and under. That means any and all large gatherings are a concern. We see today that there are a number of public exposures at large faith-based events and gatherings. We believe most church congregations are vaccinated in the 90% range. However, the Minister of Health will be speaking with faith-based groups today and tomorrow to discuss ways to keep their members safe during this fourth wave. Our goal originally throughout the province was 75% vaccination rate, 2 vaccines. But with new variants, this has proven not to be enough. We are now targeting a 90% vaccination rate. We're at 86% first dose. We're running in the order of 77% with 2 doses. So we're very close, if only those first dose would get to be their second, to reaching a target which would prevent what's happening today. In short, we expect our entire province will need to adhere to the new public health guidelines. In relation to faith-based organization, we recognize the value and contribution, especially during these difficult times. We are asking our spiritual and faith leaders to ensure we reach this goal of 90% vaccination within your congregation for the safety of your own members. Places of worship are not required to submit any documentation to the provincial government, but they may be asked to prove that they have surveyed their membership and have reached the 90% fully vaccinated threshold. Also, beginning Tuesday, September 21st at 11:59 p.m., anyone traveling to New Brunswick will be required to pre-register and show proof of vaccination. This includes New Brunswickers returning to the province. Residents of Campobello Island will need to register, but regardless of their vaccination status, there is no requirement to isolate if they are traveling back and forth to mainland New Brunswick. Travelers who are unvaccinated or who have only received one dose of COVID-19 vaccine will be required to self-isolate for 14 days. They can stop isolating if they receive a negative COVID-19 test after day 10. Online registration for travelers to New Brunswick will be available beginning Tuesday, September 21st. Finally, in the changes recommended and accepted by Cabinet, everyone working or living in vulnerable settings will be required to be fully vaccinated, or they will be required to wear a mask and undergo regular testing.
This includes all person who works or lives in assisted living lodging, or a community kitchen, or an establishment of mental health centers, or for dependency treatments. This includes as well any person that works in a health home or an establishment, residential establishment for adults, or nursing home. People who cannot receive vaccinations because of a medical exemption will have to present a proof of this exemption.
In this fourth wave of the pandemic, it is imperative that we continue to do what is needed to protect ourselves. These changes are necessary to ensure that our province is able to remain in green while slowing the spread of COVID-19, minimizing the impact on our healthcare system, and encouraging eligible New Brunswickers to get vaccinated as quickly as possible. There will be consequences for those who do not follow the rules. If you enter this province without valid proof of vaccination, if you present false proof of travel or vaccination, or fail to show proof of travel or vaccination to an enforcement officer, you could face a fine that would range from $172 to $772. For anyone who's fully vaccinated, the changes will come into effect next week. They will have little impact on your life, aside from having to show proof of vaccination. We want to continue to recognize those who have taken the time and the effort to become fully vaccinated, to do their part to protect themselves and to protect others. We want to allow them to carry on life as normal and to recognize what they have done. For those who have not been vaccinated and are eligible and able to do so, now is the time to make an appointment and get your first dose or second dose of a COVID-19 vaccine.
The measures that we're announcing today are going to allow to protect many people in New Brunswick, notably those people who are immunodepressed and those who are too young to be vaccinated. These measures are also going to allow not to permit additional pressures on our healthcare system.
As our vaccination rates rise, we will continue to work with public health and see whether these rules remain necessary. But for now, these measures are required if we want to continue to move forward as a province while keeping New Brunswickers healthy and safe. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup, Monsieur le Premier ministre.
Thank you very much, Premier Higgs and Dr. Russell. We'll now proceed to questions from the reporters. You have a right to ask a question in a language of your choice. Each reporter will have one question and a follow-up, very rapid follow-up. Please turn your mic on to speak.
Questions from members of the media. Each reporter will have one question and a very quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Laura Brown, CTV.
Hi, Premier. I'm wondering how you go about making sure the employees at some of the establishments you mentioned are also vaccinated. Will that be up to the business themselves?
We will be giving very clear guidelines for business owners. That's what's been requested from the Business Federation in order to ensure that they can explain not only to their employees but to their customers what the public rules are around from the government and public health. And so it's very clear. Owners have the obligation and the right to insist that their employees be vaccinated. They also have the obligation and the right under these rules to suggest or say that someone who's not vaccinated will not be allowed to enter the premises. That condition will exist under these new rules. It's important that we impact the daily routine of people that could be vaccinated and have chosen not to be. We are trying desperately to recognize those that have been vaccinated and to allow them to have life as normal as possible. But what this means, if we continue not getting the rates and levels that we need, then we have to keep moving deeper, and which means more impact on everyone's daily life. So it's so different than it was before. We have a solution. A year ago, we were looking for solutions. Now we have one. So we're reinforcing the ability for everyone to adhere to and be part of that solution.
Do you have a follow-up, Ms. Brown?
Dr. Russell, I understand privacy rules, but we don't know where these people are in the province in hospital. So I'm wondering if you can tell me the number of people in ICU. Are they all unvaccinated?
Well, I've mentioned several times that, again, for confidentiality reasons, that is a challenge to divulge specific numbers. I can just say in a general sense that the very large proportion are unvaccinated.
But there may be somebody in hospital in the ICU who is actually vaccinated.
Well, again, they're either unvaccinated or partially vaccinated, which doesn't allow the full coverage. That's as much as I can say right now.
Travis Fortnum, Global TV.
Hey there. My question is for the Premier. You mentioned some of the fines that folks coming into the province with falsified documents or fail to provide full vaccination documentation. But for people who try and enter a business without being fully vaccinated, what are some of the enforcement options there?
Well, it could be the same requirement, because we are suggesting and saying that that's the rules that we're putting in place today, and in public gatherings like we have indicated on this list that are examples would require individuals to be fully vaccinated in order to enter. So that same enforcement of the rules and fine could apply in that situation. So it wouldn't be any different.
Mr. Fortnum, do you have a follow-up?
Yeah. So we've been hearing this messaging over and over again, and we've seen kind of elsewhere in the nation the response to rules like this. I'm wondering what the plan is if we meet similar resistance, such as protests or further than that.
The sad part about this is that what we're trying to do here is make it an encouragement for those that are unvaccinated. And if I say, if I look at 87% that have a single dose, it just begs the question, why wouldn't you get the second dose? When we get up into this 85 and 90% range, we wouldn't be having this problem if we're at that level with 2 doses. So it's like, has there been a reason? Well, if your daily routine is impacted, then we're hoping that's enough reason for someone to say, okay, well, I'll get my second dose. And hopefully enough, 3 or 4% more will get their first dose and second. So it's just another reason to compound the reality that with the variant, this is different. When I indicate today, and Dr. Russell, that this is the highest caseload we've had in a single day since the pandemic began, it's kind of unnerving to think about that in the reality of what we're facing. So we haven't been in this same situation throughout the entire pandemic, and there's a solution. I mean, we went through the pandemic without a solution, but now we have a solution, and we're asking people to take advantage of that. We are encouraging in a very constructive way and a disciplined way to take advantage of the solution and help us reach our threshold.
Thank you. Savannah Odd, Telegraph Journal.
Yeah, so these indoor spaces on the list, I'm wondering, will staff intern in these places now have to provide proof of vaccination? So if people are entering these spaces like restaurants, etc., do the staff of those restaurants, etc., now also have to be vaccinated?
That is up to the owners of the facility. I mean, we've said that throughout, that we are expecting owners will, want their staff vaccinated, especially ones that are forward-facing to the public. But it is an owner's discretion to say, I want my staff all vaccinated, or I will test and mask. So there is that discretion with owners of establishments and their employees.
Do you have a follow-up, Savannah?
I do, thank you. So I guess, how are you certain that there's, I guess, a critical mass of businesses that are willing to enforce this?
Are we certain? No, I won't say we're certain. We did get a very comprehensive report from CFIB that there was a kind of a rationale of a number of criteria that they would like to see met in order to put this in place. And there was a mixed feeling between businesses and not. However, what was consistent is we don't want to shut down again. We don't want to be in a case that going back to lockdown or in red or in orange. We want to stay open. Well, what we are trying to do here is continue the philosophy we've had from the beginning, keep businesses open, but do it in a way that can keep people safe at the same time. So we're anticipating there will be a significant compliance within the business community, and there will be so because they want to keep open. And when we're clear on what the guidelines will be, WorkSafe will work with the businesses. We'll continue to provide direction with public safety and through public health so that we can help them put the rules in place that would be very direct, very straightforward, very clear. And that's why, we give ourselves this week. Here it comes, and it's coming and be effective as of midnight on the 21st.
Thank you. Hadil Ibrahim, CBC.
Thank you. This question, if I could get an answer from Dr. Russell and the Premier on the same question. Alberta's Chief Medical Health Officer, Dr. Dina Henshaw, said lifting all COVID-19 restrictions contributed to a narrative that COVID is over, and it played a part in the intense fourth wave. So now that we have the highest numbers to date, do you think New Brunswick going to the green phase has had the same effect? Do you have the same regrets as Dr. Henshaw?
I did read that story, Hadil, and I guess I wouldn't say that here in New Brunswick our narrative was that COVID was over. I think we looked at our epidemiology and public health recommended and Cabinet agreed that we could lift the measures based on the data that we had, based on our immunization rates and what we expected the uptake to be. So I think that's all I can say about what's happening here in New Brunswick right now.
And I think if I was to add to that, when we were throughout this, as I said, we're trying to balance the businesses being open and life as much as normal as possible. But back on the end of July, we were looking at can we allow people, because we were in the 70% range or 68, 69% range, would it be conceivable that we could balance out, where we are vaccinated with what we've seen for transmission and have a balance in life again. I think, we were considering all aspects in our discussions with public health about mental health and what this is doing to families and not being together. So, did we avoid some of the anxiety that was being created elsewhere in the country because people were just so locked down and shut down? And so there was a balance. Did it contribute to a reduction in the vaccination rates? We anticipated going to 75% within a couple of weeks of that announcement, and it didn't happen. It took a little longer. But we're 6 weeks away from that July 31st, opening. And we're just now, in the last week, experiencing something more than we would have maybe. We knew we were going to have more cases. And the trigger, as public health have always been very clear, was hospitalization. But we're just seeing that now at a level that, okay, this has gone up faster than we'd like to see, and vaccination rates have been lower than we'd like to see. The variant has put a new element into it in relation to transmission, and that adds to the complexity, and that's why the adjustment of the total vaccination levels. But at the end of the day, you know, we've always reacted to the situation at hand. We've always looked at the science of where we've been. Public health have done a tremendous job, contact tracing, laying out what our forecast could be, and how we could move into the next phase. We will continue to react based on the conditions of the day, and that's what we have done, and that's what we're doing today.
Thank you both. Ms. Ibrahim, do you have a quick follow-up?
Yes, for Dr. Russell, do people who've had no doses at all still have to wait 28 days between doses? And if yes, what do you have to say to them while they wait for their second dose to access the businesses you mentioned?
Well, I don't have a lot to say other than that's, you know, we're following the recommendations that NACI has provided to us around dose intervals. So in terms of the science of how the vaccines work and how they affect our immunity, that's the reality. That's what we're following. You know, not being able to access non-essential businesses in the meantime. Again, we're trying to address a critical need for people to get vaccinated. We're trying to address the need to make sure that we can continue to offer services in our hospitals, in our ICUs. That is what we're trying to address right now.
Thank you.
Thank you.
Vicki Hogarth, CHCO TV.
Thank you, Bruce. Premier Higgs, when it comes to asking for proof of vaccination, enforcing compliance might prove to be a challenge for some businesses. How do you propose businesses deal with difficult non-compliant customers, and will it be up to each individual business when a proof of vaccination is required to screen each customer?
Well, I think we have seen this, you know, rolling out in other provinces as well. And the request of having a level of vaccination is important for us. I think what we've seen that's bringing this to the forefront is that when those that are unvaccinated knew something was changing and knew that their lifestyle was going to be impacted, we saw an uptake in the vaccination levels. And that's what we're hoping for here, is that we will see this uptake. And you know, we may only be talking to be having this enforcement requirement for 2 weeks or 3 weeks or whatever if we get that level of uptake. So at this point, you know, we would post the requirement. Business could post, you know, we're planning on providing a government document that basically said these are the rules of entry to this facility. Because one of the concerns that the businesses had was, you know, they don't want to be in a position where they're confronting customers. And I get it. It isn't a decision they've made on their own. It's a decision that we as government have to take responsibility for. So we want to give them the cover they need to recognize that it's a government decision and they are only following the rules that have been laid out, and that we will, but we're not expecting that there's going to be, you know, a huge, let's say, resistance other than what we're seeing from a select group, and that'll continue no matter what. So right now, we would say we've got 87 to 90% of the people in our province that have chosen to be vaccinated. 13% of them have chosen to be vaccinated once at this stage, or maybe 10% in that range have chosen to be vaccinated once. We're asking them to get their second vaccine, and let's get this under control. That should be a slam dunk because they already have got one. We need to speed that process up.
Ms. Hogarth, do you have a follow?
Yes, I'm wondering, Premier Higgs, if you have any more details on how the compliance officers will be operating, and as well when it comes to visitors to the province being double vaccinated. Will there be border checks at land border entries again?
At this stage, no, we're not planning to set up the interprovincial border checks. It may come to that. You know, it's fair that this is very much based on integrity. It's very much based on the requirement to register, and then when you're approved, we have not only information about your coming here, but when you're asked to show proof of registry, proof of compliance, to any facility, any business here in the province, then that is the opportunity that we will be able to determine whether you're compliant or not. Public safety will be doing spot checks. That's true, but it's not to the level it would have been previously because we're not in an emergency order. We are following the rules that are allowed under public health regulation to protect the general health of the public, which certainly gives us the right to enforce those rules. But border checks would require us being back in emergency order, which, if necessary, we will go there. But at this stage, it's going to be based on if you want to move around our province, your ability to do so, not being fully vaccinated, will indeed be restricted.
Thank you. Cédric Thévin, Acadie Nouvelle.
Good afternoon. Question for Dr. Russell. I'd like to know if there's any information about vaccines of those less than 12 that they might be able to get vaccinated. So we have not received the information on that population yet. We're waiting for recommendations from the NACI at the present time. So we do not have that information at the present time. Cedric, do you have a follow-up question? Yes. This time for the Premier. I'd really like to understand concretely how the government is going to help business people to get to respect the regulations concerning the passport or the vaccination order.
So as we did during the entire pandemic, the businesses, we have the hotline that we've identified for access, and that's to help business navigators to work with each business on what's required and how to manage the rules. Additionally, WorkSafe will be part of that, and they will work with businesses as well. So it's basically, comes down to simply identifying the compliance around vaccinations. And it's consistent with what we've seen in other provinces. And the adherence to that is coming, in some provinces it's coming later. I think Nova Scotia, it's coming in October. We're able to do this a little sooner because, as I had said in previous press releases, that we were planning to do the next step. We weren't waiting to get to this position. We were planning the next step if we got to this position. So that's where we are. But I feel good that the process was already established to work with businesses to help them through this. And so we'll be doing that over this next week. And so as we gear up as providing the right information and helping them to help themselves, because the idea is to keep them open and fully functional at the end of the day and get more people vaccinated so they have less and less people coming to their establishment without meeting the requirements.
Merci Cédric. Merci Monsieur Premier Ministre. Laurel Isle, CTV.
Hi, thank you, Bruce. This would be for Dr. Russell. It was mentioned in the briefing the situation we're dealing with in our healthcare system. How many healthcare workers are now out and isolating due to COVID-19?
The last number I heard, Laura, was 55, but I can confirm that. And I just wanted to add another couple of points. The My Health NB system is a little bit stressed at the moment. So for those folks who need to go to the My Health NB website, perhaps wait a day or two. That system is quite stressed right now, so please don't do that. And the other message that I needed to pass on as well was that from the contact tracing teams, et cetera, the assessment center staff and also the people that are booking appointments for testing, we are a little bit behind. We are backed up. The assessment center staff are actually trying to call individuals back to book their tests, but they're having a really hard time because people are not answering their phone. So if you do see something that says private number or unknown caller or a PNB, please answer your phones, and that will help us get you in the queue for getting your appointment and getting tested. And then also, the number of staff that are out right now for COVID-related reasons in terms of healthcare workers is 71. And we don't have a healthcare system that has, the most robust human resources at this moment in time, which was the case prior to the pandemic. So that is a really huge stress on the system at this moment in time.
Ms. Lyle, do you have a follow-up?
I do. I'm just looking for an update on the status of the outbreak at Harvest House in Moncton.
My understanding is there are 7 new cases. And 31 total. I think 31 in total, but I don't have the breakdown of staff and guests at this time.
Thank you. Bobby Jean McKinnon, CBC.
Yes, hello, can you hear me?
Yes.
Thank you. I'm just wondering, will the government enact additional legislation to provide greater certainty for businesses that they can't be sued for refusing service to someone who fails to provide proof of vaccination?
Yes, if I heard that question properly, would there be protection and liability that might be associated with not serving customers? If I understood that question, is that correct?
Yes, thank you.
Yes, that was another point that was raised in relation to in relation to CFIB report, and we would be looking at that as part of making it very clear that the business was indeed following a government directive, and therefore not an individual discretionary item in the business itself. So we recognize that would be a concern, and it was pointed out in the report. And we will address that accordingly in clarity of our instructions.
Do you have a follow-up, Ms. McKinnon?
So just to clarify on that point, though, are there legal protections for businesses with this change?
I think what it was, I understand it, and we'll get the final approval from our legal team. But as I understand it, as long as it's clear that the owner is providing and following guidelines as set out by the government, they are just following the rules of the day, and they're not exercising any individual, let's say, discretion or I should say opinions or anything that would cause them to be accused of discriminatory act. So that is their concern, and I understand that. And so us having a posted requirement of what is necessary to enter their facility that they can point to and say, I'm following government rules and regulations, provides them with that protection against any lawsuit.
Pascal Rochnog.
Pascal Rochnog, Radio-Canada. Yes, my question is for the Premier. Dr. Russell said that most of the people who contract COVID-19 affected by people who are unvaccinated. So why do you not impose a proof of vaccination for business employees where clients must show a proof for vaccination?
In the case of business employees, I mean, we've done that within government. In the case of business employees, they have an option. They can enforce it because as a right to as an employer. But equally, we intend that if they do not have proof of vaccination, they will be masked and they will be taking regular testing. So those are options that are available to them as such. But I anticipate pressure will be more and more on full vaccinations.
Mr. Rochnog, do you have a follow-up question? Yes, I'd like to understand why you made that decision.
Well, I think it's giving some flexibility to protect customers, protect the business that they operate under, and but I do believe that with what we're putting in place right today, that it'll be a continued pressure on the business because people who want to frequent a facility will want to know that the employees there are indeed vaccinated. And I believe that we will see more and more pressure in that regard to have that done. But will that be next? I suppose it is definitely a possibility, but it's something that at this point we think we've likely what we've done is sufficient for now.
Merci. François Leblanc, Radio-Canada.
Oui, bonjour. Une question.
Just a question, a two-part question, Mr. Higgs. How do you think that sports organizations where there are a lot of volunteers that go, swimming, for example, and volleyball clubs, private volleyball clubs, how can these organizations be able to manage the demand for proof of vaccination passports for their activities and training, and there's spectators that come in to see them? So who's going to manage that? Is it the arena, the sports center, or swimming pools, or is it between the seas? We didn't check if anybody had all their vaccinations. So who's going to be responsible for that?
So currently, the operators of the facility under these rules would be responsible, and I know it's an added imposition. It would be more of an imposition if we ended up, closing the facilities down now. But I would take the Harvest Festival that's underway here in Fredericton right now. They've basically made a decision that everyone that attends these events will be fully vaccinated. I mean, those are the rules. You want to go to this festival, you will be fully vaccinated. So it's not a difficult concept. And so if you want to participate in swimming festivals and such, get vaccinated. It's pretty straightforward, really. And that's what we're trying to make happen here. But until that time, yes, it is inconvenient. And I got to say that's part of this whole objective. If life is a little more difficult for those that choose not to be vaccinated at a time when others' lives are threatened because of it, just maybe the decision will be made, okay, it's time.
As-tu un suivi?
Follow up, Monsieur Leblanc? Yes. For those 12 years and under cannot receive a vaccination, there's possibility there can be contamination between these youth. How are you going to manage that? Are you going to be keep a closer eye on these young children because they cannot be vaccinated and they have to live through the problems of proof of vaccinations that they cannot be able to obtain?
You're absolutely correct. And what is sad is that we have found that in our schools today, many of the outbreaks have been related to parents who have chosen not to be vaccinated, and their kids have come to school, and then they have spread the virus throughout the school, or at least started it. So it's kind of a catch-22, isn't it? Where does it start and where does it stop? But we know that under 12 at this stage cannot be vaccinated, and that's the reality of what we're dealing with. We want to keep the schools open, but we're relying on parents to take the responsibility for their kids and other kids in the school at the same time to do their part. And we just need them to step up at this time.
Merci, Monsieur le Premier ministre. Merci.
Thank you, Monsieur Leblanc. Callum Smith, Global.
Bud.
Sure, thank you. I have another question regarding Harvest House for Dr. Russell. I'm wondering what is happening on the ground. Like, what is the prompt team doing, and how challenging is it to manage an outbreak in a shelter?
Yeah, my understanding is they were able to move the guests and staff to a different location to make the management of the outbreak much easier. So that's the latest in terms of how things are going. And, again, they'll continue with testing. And again, my understanding is they were starting to move people this morning, and the rest of the people will be moved this afternoon. But again, my understanding is that all the work that needs to be done is being done. And so that's a good thing.
Mr. Smith, a quick follow-up, please.
I just have a quick point of clarity on that. When you say they're moving people, does that mean people who are positive or those who are not positive? Do you know?
Oh, I'm really sorry. I'll have to get back to you on that one. I feel like they were moving the positive people, but I'll get back to you on that one.
Sure. And I do have a follow-up. I'm wondering how many of the cases right now in the province are in youth under 12?
The breakdowns that we have are under 19, I believe, and 10 and under, so I don't have it 12 and under.
Thank you. Derek Zubé, TVA. Derek Zubé. David Coach, Brunswick News.
Thanks. Dr. Russell, regarding shelters, could you clarify, am I right in understanding people working in shelters, as they're considered vulnerable settings, will require a vaccine, but guests or residents won't?
I'm going to have to get back to you on that one, Tom.
Sorry, David.
Oh, sorry. You sound just like Tom Bateman.
Okay, well, but what efforts are underway in terms of vaccination outreach for homeless people at this point?
My apologies. It is in our press
problem.
release. Yep. So if you want that information. So yeah, people who live and work in certain communal settings, including nursing homes, adult residential facilities, assisted living facilities, shelters, community kitchens, and addiction and mental health treatment facilities will be required to either be fully vaccinated or wear a mask and be tested regularly for COVID-19.
Yeah.
So if you live or work in a shelter.
If you live or work in a shelter, I see.
Your follow-up,
okay,
David?
and so what efforts are underway in terms of vaccination outreach for the homeless population?
Well, during our immunization campaign, they were targeted. All the shelters in the entire province were targeted in terms of getting vaccinated. But as you know, it is a transient population, so that work is ongoing and will continue.
Thank you.
Thank you. I accidentally cut off Bobby Jean McKinnon, didn't let her get her follow-up. So, Bobby Jean.
Yes, hi. Thanks for coming back to me. Now that NACI is recommending third doses for immunocompromised people, what's the plan for getting those doses to people in New Brunswick? And if there isn't one, why not?
We have been working on that behind the scenes, so more to follow. Again, we've been keeping on top of, we were waiting for NACI to make their recommendations, and we're prepared to start rolling that out very, very soon. We're just finalizing all those operational things this week.
Thank you, Ms. McKinnon. That concludes today's update. Thank you very much. Voilà la fin de notre mise.
That puts an end to our update. Thank you very much.